Over the last 1 year, Kenyans have experienced 3 waves of the Covid-19 pandemic. According to the Ministry of Health, these waves are experienced every 3 months, and with each wave has been infections and deaths. Untold pain and suffering of many Kenyans and families struggling to stay alive and beat the virus. My name is Dr. Masi Korir, and on this episode of KTN News Health Watch, we look at the next predicted wave, the 4th wave of the Covid-19 pandemic, and why that wave might be more lethal than what we have seen before. Mid this week, India recorded the highest ever daily death toll of the Covid-19 pandemic. More than 4,500 people died in a day, the highest daily number of any country since the pandemic. The country of 1.3 billion people has been buckling under the pressure of its second wave of the pandemic, a wave of global concern.
WHO has been responding to the surge in cases in India and other hotspots. However, demand is currently so high that WHO needs immediate funding in order to sustain its technical and operational support to all countries, especially the most affected, involved in the present wave.
Crematoriums are overwhelmed by the ever-increasing demand. Gravesites are running out of space, and it is despair and anxiety for many people in India who are now afraid that the wave of the pandemic, which has overwhelmed hospitals in urban cities, will finally reach rural India, where the healthcare provision is weak and unaffordable for the very poor.
The surge in cases has compromised global vaccine supply, and there is already a shortfall of 190 million doses to COVAX by the end of June. COVAX works and has so far delivered 65 million doses to 124 countries and economies, but it is dependent on countries and manufacturers honoring their commitment. While we appreciate the work of AstraZeneca, who have been steadily increasing the speed and volume of their deliveries, we need other manufacturers to follow suit.
The situation is likely to be further complicated by the increase in variants that spread faster and are more lethal than the original SARS-CoV-2 that gave rise to COVID-19. The World Health Organization has termed the Indian variant B.1.617 a variant of concern.
In consultation with our virus evolution working group and our epi teams and our lab teams internally, there is some available information to suggest increased transmissibility of B.1.617. There is a preprint that is out, so this is a paper that has not undergone peer review, and it's of a limited number of patients, suggesting that there is some reduced neutralization, and as such, we are classifying this as a variant of concern at the global level.
A variant of concern, according to the CDC, is one for which there is evidence of an increased transmissibility, more severe disease like increased hospitalizations or deaths, reduced effectiveness of treatment or vaccines, or diagnostic detection failures. Apart from India, other variants of concern are South Africa, UK, Brazil, and Japan's P1 and 2 US California variants. India, after the US and Brazil, has recorded the 3rd highest number of deaths globally.
We're still in a perilous situation. The spread of variants, increased social mixing, the relaxation of public health and social measures, and inequitable vaccination are all driving transmission. Yes, vaccines are reducing severe disease and deaths in countries that are fortunate enough to have them in sufficient quantities. And early results suggest that vaccines might also drive down transmission.
In 7 days, India had reported more than 2 million cases and 28,000 deaths. Brazil, South America's hard-hit country, on the other hand, had reported almost 500,000 cases in 7 days and more than 13,000 deaths. Brazil's first wave was in July-August 2020, after which there was a lull before another peak in January-February 2021, which seems not to have dipped but rather remaining almost sustained. Another higher peak being experienced in March-April, when the country was reporting more than 90,000 cases a day. In April, the highest daily death toll was 4,190. From Brazil in South America to Taiwan in the Far East, the surge in coronavirus cases can be unpredictable. Taiwan moved from a 7-day average cases of 5 to the current spike of 150 cases. The island of 24 million people had fewer than 1,000 cases, most of which were new arrivals into the state. Its death toll was 12, and in 253 days, they had not recorded any local case. But in about 4 days in May, they reported more than 90% of their caseload and positivity rates of 10%. From all this and lessons from Kenya's own COVID-19 trends back home, the Ministry of Health is sending a warning.
If we look at mortality pattern from March, we analyzed our data for mortality from March last year to March this year. And a clear picture is coming out from that analysis showing us that we had a peak in July, and after a peak, 3 months later, you have another peak. So from July, we had another peak in November. So July, August, September, October, the third peak in November. Then from November, now we have had a peak in July. So we can categorically state, if this situation obtains, that our next peak is going to be in July. So what we need to do is to ensure that even if you have a peak in July, it's a small peak, by simply trying to adhere to these public health social measures.
It took Kenya 8 months from March 26, 2020, when the country had its first death from COVID-19, to report 1,000 fatalities from the viral disease. It took another 5 months to record another 1,000 deaths, and only 2 more months to get to 3,000. With every interval between the peaks, the number of people dying have increased significantly. The Health Ministry now projects the fourth wave will begin in June, July, at the peak of the cold season, and is likely to be more lethal. Scientists have documented increased cases of COVID-19 when temperatures dip. During the first wave in August 2020, the country reported an average 14 deaths a day. 3 months later, in November, during the second wave, the average daily deaths stood at 19. During the most recent third wave, which lasted about 3 months from February, the country registered an average of 21 deaths a day. Kenya's situation, with schools reopened, strict restrictions of movement and curfew rules eased, the next wave is likely to peak as predicted by the Ministry of Health. The existence of the India, UK and South African variants in the country is also likely to make a bad situation worse.
Let's not hide the truth. The same thing happened in India. People were not heeding the protocols. And when it started rising, stopping it was very difficult. Already, the isolation center here at Jaramogi is full. Jaramogi is even using facilities in Siaya and some lower facilities here. And very soon, all these facilities will be full. Then people who need medical attention will be on the streets or on verandas crying. So I'm appealing to people. Let us be serious about obeying COVID protocols.
To manage hospitalization and deaths linked to COVID-19, scientists are pushing for herd immunity, which the World Health Organization describes as the indirect protection from an infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. So far, Kenya has almost exhausted its stocks of the COVAX facility-donated Oxford AstraZeneca vaccines after more than 945,000 people received their first jab. Majority of these people are aged above 58 years, healthcare workers and teachers. But when the next dose will be available is currently unknown.
The shocking global disparity in access to vaccines remains one of the biggest risks to ending the pandemic. High and upper middle income countries represent 53% of the world's population, but have received 83% of the world's vaccines. By contrast, low and lower middle income countries account for 47% of the world's population, but have received just 17% of the world's vaccines.
Kenya is one of those low and middle income countries facing a shortage of vaccines and may not get the second shipment of Oxford AstraZeneca jabs in time to beat the 12-week maximum window period between the first and the second dose.
In the next few months, we do not expect Serum Institute to be able to supply the kind of volumes that were originally predicted. So we need to meet that gap. And so it would be really helpful to get AZ doses from other countries, as Bruce mentioned, in Europe and beyond. We're also talking to the United States, who has committed to sharing their 60 million doses of AstraZeneca vaccine that they have, and we're hoping that that would also flow through COVAX to help not only India but other countries as well. And finally, we're also talking to Moderna, which just received the emergency use listing, and there is a deal that's being signed with them for 500 million doses, but this would start in the second half of the year and continue through 2022. So we're exploring all options with companies with existing deals with COVAX, as well as companies that are still coming on board. And we need to get to our goal of about 2 billion doses being distributed to AMC countries by the end of this year. So every bit helps.
The U.S. President Joe Biden announced that his country will share its doses of vaccines as they become available after its citizens are vaccinated, noting that as long as the pandemic is raging in other countries, the U.S. is not safe as variants from these countries still threatens their health security.
We'll share these vaccines in the service of ending the pandemic everywhere. And we will not use our vaccines to secure favors from other countries. We'll work with COVAX, the international organization set up, and other partners to ensure that the vaccines are delivered in a way that is equitable and that follows the science and the public health data. Today's announcement to share 80 million doses is our next step as we ramp up the efforts to respond to COVID-19 around the world. This is all the AstraZeneca vaccine produced in the United States. All of it will be sent to other countries. And today, I'm announcing they will also share U.S. authorized vaccine doses of Pfizer and Moderna and Johnson & Johnson as they become available with the rest of the world as well. These are vaccinations and vaccines that are authorized to be put in arms of Americans. And by the end of June, when we will have taken delivery of enough of such vaccines to protect everyone in the United States will share at least 20 million of those doses, that extra supply, with other countries. This means over the next 6 weeks, the United States of America will send 80 million doses overseas.
You have seen the way it is difficult to access the second dose of the vaccine. So what we have in place instead of the vaccine, we have to have a mask on, properly put and mask sanitize, keep close, avoid close contact, avoid crowded places, and also ensure that we sanitize throughout. If we do these measures, we believe that the variants that will emerge will be able to cope.
Dr. Amoth says this would hopefully help the country cope with the fourth wave. The uncertainties about the next phase of the COVID-19 vaccination, the variants of concern, and a people's desire to go back to life as they knew it before the COVID-19 pandemic may be the ingredients that will make the fourth wave unmanageable. I'm Dr. Masi Korir.